Hello, and today I am going to be talking to you about how to laser your back with a Laser Touch 1 FDA cleared laser. So this is over the counter, you can purchase it, and in the video description I will send a link to the website where you can purchase one of these if you wish to do so. But it is cleared for all pain, pre and post surgery as well. And what it does is it uses light, and this red light is the same frequency as your cells. So as you go over your skin, it penetrates the epidermis, the top layer of your skin, and it starts communicating with those cells to start working. Gets the ATP going, the sodium potassium pump, and it really gets each cell to start working independently, and then they start communicating with each other. Because most pain that people have, if it's not due to broken bones or an accident or something like that, it is pain caused from inflammation, overuse, some sort of maybe trauma, whether you ran into something or you tripped and fell, and the tissue gets injured. And when that tissue gets injured, and the older we get, the harder it is for our body to actually heal that area. So a lot of the cells will shut down and stop working, and over time, pain will continue. That's why some people can have pain for 30 years after a trip and fall, because their body didn't actually repair that area, and the cells stopped working, and then over time, that area can actually increase, because then the cells aren't communicating with the other cells next to them, and they all start to just slowly shut down. So this starts waking them back up. And even people that have had pain for, close to 30 years can get relief in a rather short period of time with this laser. And so I work with people every single day, and I help them and teach them how to help themselves. So in this video, I am going to show you the best I can right now, since it's cold outside, so I'm not gonna be in a little jog bra. I could do another video and actually show you, but this is going to be good enough, because all you need to do is take the ultrasound gel, which I get on Amazon. You can get ultrasound gel online, and you just squirt some. I squirt some onto the actual laser, or I'll actually squirt it onto my back, and then I will use the laser. I have to say, if you do not have good shoulder mobility, and by mobility I mean being able to rotate your shoulder to work your back, to work your glutes, if you don't have that on either arm, you probably will not be able to work your own back. And I have great shoulder mobility, but I am still limited to this area. So I cannot do really my upper and mid back. The most I can do upper is around the trap area. And that's with pretty good flexibility on my part. So if you have a painful back, and you do not have good shoulder mobility, you will have to have somebody do it for you. Now I have other videos showing how that can be done, but if you do have good shoulder mobility, you could either put some gel on your back, or you put the gel on the laser and you work your entire back. Now let's say you have a tight lower right side of your back, which is this side of your back. I don't want you to just do where it hurts. You need to do all around, and you need to do the other side, because our body is all connected. So just because one side hurts doesn't mean that the other side isn't doing more work. It isn't being pulled over due to the tightness on one side. So you really need to do both sides. And whenever people have lower back issues, I always work the buttocks, because our glutes, which are huge muscles for us to propel us, to help us sit and stand and just do everything every day, I definitely work the glutes, and I do it by, again, putting gel there, and I kind of sit back and I will work the glutes. And that's how I work my own. That is really the best way to do it. Again, if you are having issues, you will have to lay down on something like a massage table or a bed on your side, and you bend your leg up and you have somebody else laser your buttocks muscle. And whenever they feel tightness or a knot, which you can feel through this because this laser is an extension of your hand, think of it as an extension of your thumb, you could feel the tissue. They should kind of go over it a little harder, kind of press into it, try to loosen that muscle up. And over time, and in some people a very short period of time, you will feel relief. I have worked on people where as soon as I was done, they really didn't feel anything, but a couple hours later I get a text and they're like, oh my gosh, I got out of my car without any back pain. So especially if you have chronic pain every day, this is something that might take some time to heal, but if you do want one, it is worth getting one and using it every day. And if you can have a friend or a spouse or a loved one, use it on you. It's very, very helpful. So again, you just want to do as much as you can. You can go right over the spine, all the way down, all the way up, and I would work this area for at least 4 minutes. Now the laser will turn on for 2 minutes, and then after 2 minutes it automatically goes off, and that's just a safety, or actually it just saves the battery. So if you're traveling and you have it in your case and something hits it, it will automatically go off in 2 minutes so that when you get to your destination the battery isn't dead. So after 2 minutes you just hit it again, the light goes on for another 2 minutes. So I would do 4 minutes each side, and then I would also do your abdominal region. Whenever you have back issues, a lot of people, sorry about that. Whenever you have back issues, a lot of people will start to almost curl forward, and so their abdominal region will get very tight. So again, put the gel on and basically work the entire area all over with gel. Work it, the entire area around your belly button, and really you can stretch a little, and after 4 minutes you will definitely notice a difference. So for today, that is a quick demonstration of how to use the laser on your back. Again, I am sorry that it's not easier. You do have to have shoulder mobility, and it is disappointing because this works so well. But if you can have someone help you, definitely help you. And if you have any questions, please leave comments in the comment to ask the questions, and I will do my best to get back with you as soon as I can. But until then, if you have a laser, use it every day. It definitely works.